Hello, this is Jonathan Kay from the University of Massachusetts Medical School reporting for RheumNow at EULAR 2021. I wish that I was in Paris where EULAR 2021 was supposed to have taken place. Instead, I've been attending the meeting virtually from home, awakening at 4 in the morning to watch sessions that are scheduled according to Central European time. Even though I haven't set foot on an airplane in over a year, I still feel jet lagged because of this time difference. Women with rheumatoid arthritis are at increased risk for adverse pregnancy outcomes, especially preterm birth and small for gestational age. But is this due to disease activity, anti-rheumatic drug therapy, or other factors? Well, in abstract OP0210, Hellgren et al. Linked national medical birth registers to prospective clinical rheumatology registers in Sweden and Denmark and compared over 1,700 pregnancies in women with rheumatoid arthritis to 10 times that number of pregnancies in matched controls between 2006 and 2018. They found a nearly twofold increased risk of preterm birth and of small for gestational age in pregnancies of mothers with rheumatoid arthritis. This risk was slightly higher in women with moderate or high disease activity. They also observed these risks to be higher in women who had been treated with biologic DMARDs in combination with either oral corticosteroids or conventional synthetic DMARDs during the 9 months before pregnancy. Obviously, it is important to control disease activity in women with rheumatoid arthritis who intend to become pregnant. However, if possible, biologic DMARDs might be avoided during the year before conception is attempted. Does rheumatoid arthritis affect male fertility? In abstract OP0212, Perez Garcia et al. Performed a multi-center cross-sectional retrospective survey of over 600 Dutch men with inflammatory arthritis who were over 40 years old and indicated that their family size was complete. They found that men who had been diagnosed with inflammatory arthritis before the age of 40 had a significantly lower total number of children than those diagnosed after age 40. However, they did not correlate this decreased fertility rate with medication use, disease activity, or other clinical parameters. Further study is necessary to determine the causes of this decreased fertility rate among younger men with inflammatory arthritis. Although obstetrical care focuses on the mother, the role of the father must also be considered. In abstract OP0211, Perez Garcia et al. Compared pregnancies conceived after the father had been diagnosed with inflammatory arthritis to those conceived before the diagnosis. They found that pregnancies conceived after the diagnosis had a higher mean paternal and maternal age at conception and a lower rate of spontaneous pregnancies. After correcting for maternal age, the risk of miscarriage in pregnancies conceived after the father had been diagnosed with inflammatory arthritis was significantly higher than in those conceived before the diagnosis. Although these observations need to be confirmed prospectively, men with rheumatoid arthritis should be advised to consider consultation with a high-risk obstetrician to monitor their wife's pregnancy. I found it interesting that rheumatoid arthritis in either partner can affect fertility and pregnancy outcomes. Much other noteworthy information has been presented today. For more EULAR 2021 coverage, head to rheumnow.com. I'm Jonathan Kay.